Hi, Ashley.
Hey, Dr. Pejic.
How are you
So
today?
I'm good. I'd like to ask you, what are some ways your mental health can impact your physical health?
That's a great question. Well, I have four categories of things that might affect your physical health, but are mental health related. So the first one would be depression. The
Mhm.
main problem with depression is that folks can often be tired and possibly overeat, and that combination can lead to weight gain. And oftentimes, folks don't realize that they've passively gained weight many months that they've been depressed if they delay getting treated. That can also lead to sleep apnea. If you gain enough weight, it can obstruct your breathing. And so when you start to when you go to bed at night, you relax your oral pharynx, or the tube that you breathe through, um, collapses and it's hard to breathe, and you don't know it's happening because you have what they call micro awakenings, which will affect your sleep architecture. That's kind of like the stages of sleep that a human normally goes through. When that happens, even though you sleep for 8 hours, the quality of your sleep is so poor that when you wake up, you're tired throughout the day. These are people who like nod off at 2 p.m. after lunch, have trouble staying awake in a lecture hall that's kind of dimmed down,
Mhm.
trouble being a passenger in a car for like a longer trip, like they'll fall asleep. Like that stuff's not normal to have typically. So depression can cause basically either obesity or sleep apnea, and that's how they're linked. The second category would be anxiety. So anxiety can cause muscle tension. So people have like muscular pain. Sometimes it's just anxiety. Aside from that, would be sleep issues, of course. So anxiety can prevent you from getting to sleep or staying asleep, which then can make you feel tired the next day. Anxiety can also be a sign of fatigue. So I like to ask patients, do you feel tired the second half of the day? So if someone's telling me they're not depressed, but they're like have anxiety and they worry excessively, a lot of those folks are just really spent like an empty cartridge by 2 to 4 p.m. And it goes on and on and on, and it's really just untreated anxiety. So there's that. Anxiety can also cause headaches. It might trigger a migraine in some people, or tension headaches. On top of that, I would say skin issues. So anxiety can sometimes bring on seborrheic dermatitis. That's for folks who get like flaking here and like around here in the back of their ears and such. So I see that sometimes. So that's the second category. Third category would be substance use. So when folks are feeling depressed or anxious, some or they're just having some stressor in life, they might lean on alcohol more. Alcohol can disrupt your sleep quality, of course. It can also affect your liver, and cause liver inflammation. It can also lead to higher rates of cancer, which folks don't often link that to alcohol. And I think recently they've said like any amount of alcohol it can increase rates of cancer over time. And the type of cancer for that would be like esophageal cancer, liver cancer, like so gastrointestinal areas,
Mhm.
but potentially like kidney cancer from what I recollect. Um, and then other substances would be like caffeine. Lots of people drink caffeine when they're not sleeping well, when they're tired, or when they're depressed. Caffeine can make you feel jittery. Sometimes that can cause seborrheic dermatitis because it's like lighting people up and they feel like nervous and anxious. Can cause heart palpitations as well. And it can make you feel tired because caffeine wears out. And also caffeine prevents you from having normal sleep. So if you drink caffeine after like 12 noon or 2 p.m., it has about a 7 hour half-life, and it lingers, and so you get in this kind of bad cycle of overusing caffeine, poor sleep, tired in the morning, overusing caffeine, and so on and so forth. Aside from that would be nicotine and tobacco. A lot of folks use those to help stimulate their brains, and give themselves energy and focus. Uh, the one thing I tell my patients that they can do for their health above and beyond everything else is just to quit smoking, quit using tobacco. So that's a major thing. And then, cocaine can be, when folks are using cocaine, that can cause heart attacks, even in young people, because it's vasoconstrictor. It can cause hypertension or strokes. Stroke is when you have a blood vessel in your brain either burst or it constricts it to where blood can't get to certain parts of your brain. And then the last category, and this is kind of an interesting one, is the treatment for mental health disorders are medications that sometimes cause weight gain. And I'll have folks who come in for a second opinion and they've been on medication for a year or two and made them gain 50 pounds. And now they have all these problems from it. So the categories of that are oftentimes second generation antipsychotics, like Seroquel or Zyprexa. Not to badmouth those medications, but they are known side effects. So patients have to be aware of that. Other things that might cause weight gain are now and again are SSRIs, like Paxil, for example. Not to pick on Paxil, but some people have this reaction where they're actually just more hungry from it, and they will graze more or crave sweets, and they don't link it to their medication. And the kicker is that they might feel better emotionally because they're on a medication that's treating their anxiety and depression. So, and they're just doing what the doctor told them to do, but they don't really know that it's causing weight gain. And because we don't want to cause our patients more problems. So those are 4 things. So depression, anxiety, substances, and medication side effects.
All right. Those are really good ones. Thank you for sharing.
Sure, you're welcome.